Sure. The next question, question number 2, under the name of Deputy Louise O'Reilly. Minister.
Thank you very much, Can I thank Deputy O'Reilly for the question at the outset, wish her well in her appointment as her party spokesperson on health, and I look forward to the debates that we'll have here in this chamber, and I hope we will, building on yesterday's establishment of the cross-party committee to devise a singular vision for the health service, I hope we'll be able to work together on that as well. In relation to the question regarding the capacity review of the National Ambulance Service and its recommendations, and I suppose where to from here, last month at my request the HSE published the National Ambulance Service Capacity Review together with an action plan for implementation, and this action plan incorporates both the recommendations of the capacity review and also the recommendations of the 2014 HICO report on the National Ambulance Service. The capacity review, as the Deputy will know, makes it very clear that we will need a very significant programme of investment in our ambulance services, and let me acknowledge that here today. In that context, planned investment in a multi-annual programme which will have to involve manpower, vehicles and technology is clearly required. Additional funding of £7.2 million has been provided for the National Ambulance Service this year, 2016, and as you'll also be aware, the Programme for Partnership Government commits to an additional annual investment in terms of both ambulance personnel and ambulance vehicles. It should be noted in terms of the action plan that a number of the key recommendations of both reviews are already well underway as part of a significant programme of reform and modernisation of our National Ambulance Service, and this has been underway for a number of years at this stage. The programme has now achieved many of its targets, including the establishment of the National Emergency Operations Centre and the creation of an integrated deployment platform which allows our ambulance service to operate as a national fleet rather than as regional divisions. We've also seen continued delivery of improved technology to improve response times and the expansion, very importantly, of the Community First Responder Scheme. Clearly there is much more to do in relation to this. The capacity review is a very good roadmap, as is the action plan, and my department is continuing to engage with the National Ambulance Service in relation to their requirements and performance, and I'll continue to do all I can to ensure that action plan is implemented.
Thank you, Minister. Deputy.
Minister, first I want to welcome the 3 newly appointed ministers here and to congratulate you and wish you well in your new roles. My question was very specific. It referred to the creation of a standalone budget. I don't think anyone would dispute that, particularly after what was done to the mental health services budget, that a standalone budget is going to be necessary to ensure that these measures are implemented. Specifically, and not in general, because we may not agree on everything, Minister, but we do agree that there is a lot to be done with our ambulance services. I would like to know if there is a plan and if there is ring-fenced funding, because saying that you have an intention to do something is not the same thing as saying we have put money aside and we fully intend to resource it. And Minister, I know you will be aware of this, but the media are reporting that a woman waited 84 minutes on a 999 call to come to her in Cavan with very, very serious outcomes. And I'm not suggesting for a moment, pending the investigation, why, but I am suggesting that 84 minutes is not acceptable. People can't wait. They need to have confidence in the ambulance service, Minister, and regrettably at the moment they don't. So we need to hear from you specific detailed plans, but also the money to ensure that those plans can be implemented.
Thank you, Deputy Minister.
Well, I think you make a number of very fair points, Deputy, and you're right. I mean, it isn't about more than generalities. It's about what specifically are we going to do. And I suppose what I would be saying to you here today very clearly is that the programme for government, which is my mandate and what I need to implement along with my colleagues in the Department of Health, commits this government to increasing the number of people working in our ambulance service and indeed the number of vehicles available to our ambulance service. And I'm happy to be judged on that in relation to the implementation of the programme for government. Obviously, when you'll start to see concrete details of the delivery of that, it will be the run-up to the estimates process and the budget process, where I will have to show the commitment that we need to make to our ambulance service. This is going to be multi-annual, though. It is going to take a number of years, and the report is very clear, I suppose, in terms of the challenges that do face our ambulance service. The report, though, is also very clear in terms of even if we put all the resources together, and even if we can deal with all of the recruitment issues, which are difficult in terms of finding the appropriate staff at times worldwide, not just in Ireland, there are still a number of issues in rural Ireland that we're going to have to look at new solutions for. In relation to Cavan, and I might have an opportunity to come back in on this, I'll come back in on that in a moment. If that's okay.
Yeah, to be honest with you now, I was looking for something a little bit more specific than the answer that you're prepared to give me, Minister. I understand also that a significant increase in the number of personnel is going to be involved, and my understanding is that the trade unions representing the workers in the DFB and in the National Ambulance Service have sought a meeting with you. So I'd like to know from today if you are going to accede to that request for a meeting, and if you will advise the House of the result of it. I think we won't be able to address the confidence issues that people have with regard to the ambulance service, and let me be clear, no one has a lack of confidence in the personnel themselves. Everybody knows they do a fantastic job, but we will need to see specific targets and figures, and unless and until we see those, I don't believe that people are going to have the confidence that the capacity review is going to be implemented in any meaningful way.
A brief response, Minister.
Specific. Four specifics, in fact. Firstly, in terms of specifics, there's €7.2 million for the ambulance service this year, as I've already outlined, which will enable the creation of new developments within our ambulance service. Secondly, within a week of my appointment as Minister for Health, I went to Cabinet and got this report published that was long overdue and that needed to be published. Thirdly, in relation to your request for a meeting, I'd be delighted to do so. I've already had an initial engagement with SIP2 in relation to this, but I'd be very happy to have a specific meeting, and if you want to contact my office, we can certainly arrange that, and I will update the House on that. And fourthly, I don't want anybody to think that these are all vague aspirations. The action plan, which is available on the HSE website, is very specific, and let me just give you an example. In relation to the Lightfoot, the capacity review, the external review of the ambulance service, there were 60 actions arising from that. Of the 60 actions, 28% are deemed complete, 45% ongoing, and there are 27% that have yet to start. In relation to the HICWA action plan, there were 54 actions, 35% of them complete, 52% ongoing, and 13% that have yet to start. And again, when anyone looks through this document, very detailed in terms of the timeline, when it needs to start, when it needs to be delivered, what exactly it means. So this is the document in terms of the roadmap for our national ambulance service.
Thank you, Minister. Thank you very much.
I'll absolutely cut money, and this government is absolutely committed to continuing to increase investment in the ambulance service. We began it in the last budget under the last government, and we'll continue it in this government.
Thank you very much, Minister. Question number 3 under the name of Deputy James Brown. Minister, your response.